Good day, everyone. You're welcome to the Education, Research and Training webinar series of Psycho-Oncology Society of Nigeria. Can you hear me now?
Yes, yes.
Yes, we can hear you.
Can you hear me now?
Yes.
Yes.
Can you hear me now?
Yes, we can.
Okay,
yes,
good.
we
So,
can.
sorry that we have to do that again. Good day, everyone. You're welcome to the Education, Research and Training webinar series of Psycho-Oncology Society of Nigeria. As I earlier said, this meeting has been in preparation for a while, and we're very glad that we're starting today. And we're glad that we're starting with no other person than our matriarch of psycho-oncology in Africa and in Nigeria. So we understand the importance of psycho-oncology in the management of our patients. It's kind of overemphasized. We understand that cancer diagnosis affects the family, affects the individual, and also affects the other part of our lives. So the importance of giving holistic care to our patients is very vital, is relevant, and we're so glad that the interest and the relevance of psycho-oncology is beginning to take its place in
Dr. Sarimiye? Okay, it's like Dr. Sarimiye's network is acting up. So maybe I should just continue for the sake of time with the introduction to, I'm just introducing psycho-oncology to us.
So can you hear me?
Okay, you were lost for a while, but you can continue.
Okay, so I was talking about that the importance of psycho-oncology. And so without much ado, I would call on the president of the Psycho-Oncology Society of Nigeria, Dr. Akin.
Okay. Thank you, Dr. Sarimiye. A lot of interest. People have been showing a lot of interest in psycho-oncology in recent times. And that's one of the reasons that we thought to have this webinar so that as many people as are interested can be educated about psycho-oncology. And so I'll just start with a brief intro about POSON, Psycho-Oncology Society of Nigeria. So the society was founded on the 24th of April, 2009, and the objectives of POSON, amongst others, include offering psychosocial services to those affected by cancer and providing training to psychosocial oncology or psychosocial oncology to oncology clinicians and everyone, working in the cancer space to be able to give attention to the psychosocial issues that those affected by cancer. And when we say those affected by cancer, oftentimes people would think it's just the patients. But those affected by cancer are much more than the patients. Even you and I, working in the cancer space, are sometimes affected by cancer. And the caregivers of these patients are affected by cancer, and then the patients themselves. And so psycho-oncology is about providing care for the psychosocial needs of these patients, their spiritual needs, their emotional needs, social, and all of those issues that surround them because they have cancer. And this is not something that the biomedical system often pay close attention to, but I believe the times are changing. And so that's one of the things that this person is trying to push. And we are also involved in conducting behavioral cancer research and act as patient advocates. So the association became a member of the International Psycho-Oncology Society Federation of Psycho-Oncology Societies in 2011. And over the years, we've been conducting research in different parts of Nigeria. And we've also been conducting our national scientific conferences and workshops and trainings. And by September, we'll be having our 13th conference. That is between 5th and 6th of September 2024 in Enugu at the Neuropsychiatric Hospital. We'll be having the 13th conference so far. I won't bore us with the definition of what psycho-oncology is and all of that, because that's what our speaker today will be talking about. Lots of questions actually came in during the registration, because we asked people to register online. So the links can be sent, and more people than are right here actually registered interest, and they had lots of questions. Some of these questions will be addressed from the topic of today, and some of the other questions will serve as the foundation for other webinars, because the essence of asking those questions is to have a needs assessment that will ensure that the trainings we are given, the webinars we organize, are meeting the specific needs of the audience, of the oncology clinicians that are attending the webinars. And so some of the key questions like cancer and sexuality, how to help children whose parents are affected by cancer. And those are questions that will be addressed in a whole webinar. But I hope that other questions that are related to today's topic would come up, and they will be addressed. So welcome again, and I hope you'll find this very educative. Thank you. Dr. Sarimiye, please.
Thank you, Dr. Odoye, for the brief introduction on psycho-oncology. Thank you so much. So without much ado, I would call on Professor, our facilitator and speaker for today. But before I do that, I would like to read a citation. Professor Chioma Asuzu is a professor of clinical psychology and psycho-oncology at the Department of Counseling and Human Developmental Studies, University of Ibadan. She is also appointed as a consultant in psycho-oncology in the Department of Radiation Oncology, College of Medicine, University of Ibadan. She founded the clinical unit of Psycho-Oncology, University College Hospital in 2013, and is instrumental in the establishment of the master's degree program in Psycho-Oncology, which is domiciled in the Department of Radiation Oncology, University of Ibadan. Our responsibility spans teaching, mentoring, providing psychosocial care to patients with cancer, conducting psycho-oncology research, and advising hospital leaders in the area of psycho-oncology. She is the foundation president of the Psycho-Oncology Society of Nigeria, POSON, the president of the Association for Psycho-Oncology in Africa, HAPWA, and the vice president of the International Psycho-Oncology Society, IPOS, and the co-chair of Low and Middle Income Countries, LMIC, Special Interest Group in IPOS. She has previously served as the vice president, West Africa, of the African Organization for Research and Training in Cancer Aortic from 2017 to 2021. She's a director in IPOS, the first African to hold that position in IPOS from 2015 to 2019. She served in the executive capacity in IPOS as a secretary from 2019 to 2021, and also as the immediate past treasurer before becoming the vice president of IPOS. Professor Chioma Asuzu won the IPOS Jimmy Holland Memorial Award in 2021. She is working hard to spread the knowledge and the practice of psycho-oncology throughout Nigerian universities, the teaching hospitals, Africa, and other LMICs. She has supervised several PhD students in the area of psycho-oncology, thereby building and developing the body of knowledge Pardon me. She's the principal investigator and co-investigator of several grants from local and international granting bodies. Please let's put our hands together and make a warm welcome for Professor Chioma Asuzu as she takes us in today's webinar series. Prof, you're welcome.
Okay, oh, you couldn't hear me. I was saying thank you very much for that citation.
Okay.
Thank you very much. I'm very grateful
for
those that read it, for those that wrote it, and for those that read it. Yes, thank you. I'm very grateful. So I will come in video now, and then I will try to share my video.
You're welcome, Prof.
You will give me permission to share.
Yes, you are a co-host, ma, so you can share. You are a co-host.
Okay. Let me look for the. Where is my? I post webinar. Okay, this will be this. Let me start. That was where I stopped it. Okay. So I want to say thank you very much for asking me to talk on the first IPOS webinar in 2024, the first ever IPOS webinar. Thank you for that opportunity. Then this is my outline. I want to look at the concept of psycho-oncology, topics in psycho-oncology, role of psycho-oncology, pillars of psycho-oncology, what is oncology, importance of psycho-oncology, psycho-oncology continuum, broad areas of psycho-oncology. I think they are even worse. And then I always like to noise. There is a background noise, right?
No, full screen. Make it full screen.
Aha, that's what
on top.
On top, yeah. I think it's here.
Just make it full screen.
Let's see.
Okay, excellent.
So this is a picture of Jimmy Holland. I always like to post our pictures when we are having anything to do with psycho-oncology. She lived on Earth between 1928 and 2017. And within this period, she did amazing things. She's a woman with a heart of gold. And I'm privileged to be studied under her. And not just me, my own mentees also studied under her. Because I'm this person that don't like to walk alone. And wherever I go, I like to go with people. And that has also been a lot of blessing for me because I don't walk alone. And so I have people all the time. We are doing it together. So this woman is very kind person, very, very kind. And she's interested in Africa. She's not just establishing psycho-oncology in the whole of the world, but she took special interest in making sure that LMICs, especially Africa, that we also benefit from this holistic care of cancer patients. She's somebody we will continue to talk about the rest of our lives. We talk about her for what he has done for us and what her family continues to do for us. We can't ever forget her. And my wish and prayer is that we also have to learn from her personality. You have to learn from who she is so that we will continue to duplicate pieces of her as we grow in life. The burden of cancer. Cancer has been described as a major cause of morbidity and mortality in many of the sub-Saharan African countries. It is now the 5th leading cause of death in Africa. Okay. In spite of the high mortality and morbidity rate of the disease, there is that of holistic care approach to cancer burden in Africa. And Africa is the most underrepresented country in terms of organized psychosocial care for persons with cancer. So meanwhile, psycho-oncologists have crucial roles to play in addressing attitudinal change, stigma reduction, and designing and redesigning psychological interventions to facilitate health behavior change. Only one African country, Nigeria, has an active Psycho-Oncology Society, which was founded in 2009, KG 2022. Few other countries have joined, such as Kenya and Nigeria and Ghana. They can also give necessary psychosocial support for many persons living with cancer in terms of managing emotional distress, depression, anxiety, fear of death, body image, sexuality, and a lot of psychosocial issues. And when we do this, we are going to help in enhancing the quality of life of cancer patients. The cancer, as we said, that is a leading cause of morbidity and mortality worldwide, with approximately 4 million new cases in 2012. Approximately 70% of deaths from cancer occur in low and middle income countries. Around 1/3 of deaths from cancer are due to 5 leading behavioral and dietary risks: high body mass index, low fruit and vegetable intake, lack of physical activity, tobacco use, and alcohol use. These are all within behavioral risk, which can be prevented. This poses so many challenges to behavior change agents, such as psycho-oncologists like us. Unlike in developed countries, where importance of oncology and psycho-oncology is highly appreciated, it is yet at a budding stage in low and middle income countries, especially in Africa and also in Nigeria. Psycho-oncology deals with psychological reactions to experience of cancer, the behavioral component of coping with cancer, as well as health behavior change, including preventative ones, social factors that are associated with diagnosis and treatment of cancer, including communication with providers and healthcare workers. I will underline communication with providers. And we look at it and say, what is it? Just yesterday, a woman was telling me that we should train these doctors in counseling skills. We should train them in counseling skills, that our work can never be completed unless we train the doctors in the ways of communicating to their clients, to their patients. That some of the ways they communicate can make them to feel like they want to die. You know, very, very important. And all these are within the umbrella of psycho-oncology. Psycho-oncology thereby can be described as a form of oncology care which focuses on psychological well-being of patients and caregivers in relation to their distress level and ensuring high quality of life to enhance treatment. It also looks into social, spiritual, and cultural aspects of the patient. Oncology, now we see oncology, which is a branch of medicine that specializes in diagnosis and treatment of cancer. And we know that when a patient is diagnosed of cancer, there is a lot of psychosocial issues around this patient, not just the patients, the patient caregivers, the patient family members, even the health workers. And so it is the responsibilities of psycho-oncology to interface and interact with oncologists, either surgical oncologists, radiation oncologists, or physicians that give chemotherapy. These are the people that clinical psychologists and psycho-oncologists work with. And when these oncologists understand the role of psycho-oncologists in the treatment of these oncology cancer patients, then they will collaborate better and the whole thing will move faster. Psychosocial oncology is a new cancer specialty that addresses the variety of psychological, behavioral, emotional, and social issues that arise from cancer patients and their caregivers along their cancer care continuum. Cancer can cause significant distress for patients and their families, which we see as anxiety, fear, depression, coping mechanisms, adjustments, financial toxicity. All these things are what the patient experience. So these are two psychological dimensions of cancer. The first is emotional response of patients and families to cancer. The second is emotional, behavioral, and psychosocial difficulties that influence living with cancer. Psycho-oncology is multidisciplinary in nature. I tried earlier to illustrate the multidisciplinary nature of psycho-oncology. Psycho-oncologists cannot work alone. They work with oncologists, they work with nurses, they work with dietitians, they work with pharmacists, they work with social workers, they work with everybody to make sure that they give high quality care to the cancer patients, and which will translate to high quality life that they have to live. Global history of psycho-oncology. Psycho-oncology became a subspecialty of oncology with its own body of knowledge, contributing to cancer about 40 years ago. This year, at IPOS Congress in Maastricht, they'll be celebrating 40 years of IPOS. Psycho-oncology started about mid-70s when there was a lot of stigma attached to cancer diagnosis and treatment in the United States of America. Prior to this time, patients were not told of their diagnosis because they believed that if they are told, they are going to die. They were not told. The patients were left in isolation. We are left to imagine what their problems could be. They were not informed. So, and a lot of stigma was associated with cancer diagnosis and treatment. A lot of fear about the disease, fear that this disease can contaminate them, fear that it also is attributed to shame and guilt. Many patients will say, who knew what happened to them? Maybe they did something. Maybe they did something. Sometime in Department of Radiation Oncology, one of the patients told me that, maybe it's my key I used to put in my bra that caused breast cancer. And she started feeling guilty. Some of them feel very, very guilty that this thing happened to them. And they will be attributing some of the behaviors they did earlier in their life to the cause of cancer. With the improvement of surgery and anesthesia in early 20th century, it became possible to cure cancer if the tumor was found early. American Cancer Society continues to give awareness to the public on the need to consult for suspicious symptoms of cancer. American Cancer Society was formed in 1913, and it continues to give information on knowledge of cancer, symptoms of cancer, treatment and prevention of cancer. And apart from that, they have this accommodation. They also give when cancer patients come on treatment. These days, they have a very big one in New York. There was a time that they tried to counter the ignorance, fatalism, that people don't know about the cause of cancer, and they don't want to adhere to their treatment, and they think about cancer has to do with death. They are afraid, and all the warning signs of cancer were well publicized. And to reduce the fear among the people so that they can quickly come for treatment. And that was what ACS did. Radiation oncology and surgery as a treatment for cancer joined in the first quarter of 20th century. Chemotherapy was added as a third treatment modality for cancer in the same century. And later on, Memorial Sloan Kettering Cancer Center was founded in the 1880s as a cancer hospital, and which established a research effort in the early 90s. This started with various publications on psychosocial variables in cancer patients. The first report of psychological adaptation to cancer and its treatment were made by psychiatric group at Massachusetts General Hospital, and this was directed by Feinsinger, a psychiatric research group at Memorial Cancer Center. So these two institutions actually came together to look at the problems of cancer and to look at the pattern of communication over the stages of the illness. And they found out that the less the patient communicates, the higher the disease has progressed. And these two groups and these two hospitals collaborated. Their collaborative work led to the establishment of first building blocks of what later became psycho-oncology. And Jimmy Holland is the founder of psycho-oncology, who is also referred to as mother of psycho-oncology globally. So the emergence of psycho-oncology in Nigeria. In Nigeria, the emergence of psycho-oncology could be traced to the desire of three medical doctors, a radiation oncologist, a psychiatrist, and a gynecologist, to expose cancer patients to knowledge about their disease while addressing their emotional concerns with the aim of reducing their fears and enhancing their quality of life. And we know this reason that these things were done. The radiation oncologist there was Professor Campbell. The psychiatrist was Professor O'Hary. The gynecologist as Professor Tony Mariu. And he supported this. And then it was called, this led to the establishment of Lola Mariu Cancer Counseling Center, which was situated in the Department of Radiation Oncology. The effort of these medical doctors went, they did a lot, but however, did not get to the needed and sustained services of counseling and clinical psychologists until 2004. So in 2004, we started again. Many people had been there, but we are going to talk about what we know about. In 2004, we started again. And 2004 was when I joined the services of University of Ibadan in Department of Counseling and Human Development Studies. Having met Professor O'Hary as a PhD student and doing practicum in Department of Psychiatry, he took me to radiation oncology, took me to hematology. And when I came back as a staff, I went to Professor Campbell that we need to, he said, oh, come along and come and help us to run this cancer counseling clinic. This humble beginning, marked by 6 years of altruistic, sustained psychological services, sets the stage for the establishment of Psycho-Oncology units in the Department of Radiation Oncology, University College Hospital, Ibadan, in 2010. The department now runs a master's program in Psycho-Oncology today from the University of Ibadan. The department runs that as a way of training people to obtain certificates, university certificates, which qualifies them to become psycho-oncologists. Topics covered in psycho-oncology. Topics covered are wide and varied, ranging from preventive, supportive to new trends. We have behavioral and psychological factors as risk factor. In the other behavioral, we are looking at smoking, is a behavioral thing, lifestyle, obesity, things that can be prevented. Screening of cancer in normal and at-risk populations. screening and testing of genetic susceptibility to cancer patients, psychological issues related to sites of cancer. You have a lot of psychological issues if the breast cancer, cervical cancer, ear, neck, facial cancer, body image. These are issues that are topics that are covered in psycho-oncology. Screening and assessment in psychosocial oncology. We screen and we assess and we give treatment. Principles of psychotropic management in psycho-oncology, looking at drugs that are used in managing emotional distress in psycho-oncology. The evidence-based interventions, CBT, body-mind image, there are a lot of evidence-based interventions that can be used to manage distress or to manage any other psychological problems that our patients have in order to enhance their quality of life. Geriatric and psycho-oncology is also a huge topic that can also be discussed and covered in psycho-oncology. We have also psychiatric disorders. Some of our patients, their distress can exceed beyond 7, 8. We know that is reaching psychiatric assessment. And this comes to psychiatric disorder, psychiatric depression, poor adjustment, delirium. All these things are psychiatric disorder. We also have palliative and terminal care. Psychological issues in family, survivorship, because of drugs, creating of awareness, diseases are identified early, and people are living longer even when they are diagnosed with cancer. So the survivorship is a huge area right now. We have professional education and building of supportive care programs. We also have psycho-oncology in health policy, because cancer oncologists, after doing research, you also want the findings of research to be translated to policy so that this thing can lead to implementations. And this is the era also of implementation science. We want to make sure that after all these researches that we have carried out, policy makers, politicians, and all those people can adopt these things and integrate them, and so that they will enhance the quality of life of cancer patients. Importance of psycho-oncology, we can't overemphasize it. It promotes the quality of life of cancer patients through assessment of distress at each cancer care continuum and managing the distress with appropriate psychotherapy. It improves communication between patients and the healthcare workers. It improves training ground for further the work of psycho-oncology in Africa. It creates community awareness in the area of psycho-oncology in Africa, thereby contributing to cancer control plans in Africa. It provides opportunity for the development of guidelines for the practice of psycho-oncology in Africa. It provides opportunity to conduct research in the area of psycho-oncology. It acts as patient advocate and navigation guide in some of the hospital processes, which often prove distressing for cancer patients. This is cancer care continuum, starting from the preventive, the diagnosis, and the active treatment, the survivorship, the palliative care, and all along this continuum. Psycho-oncologists have a great role to play, which I've illustrated earlier on. 4 broad areas of psycho-oncology. These 4 broad areas are psychosocial oncology services, education and training in psycho-oncology, research addressing psychological issues, publication of research findings and scholarly writings. Psycho-oncology services for patients and family members, including behavioral components of the disease, coping mechanisms, health behavior change, like lifestyle, obesity, their dieting, is all included here. Social factors associated with diagnosis and treatment of cancer, including communication with providers, effect of and importance of communication, proper and adequate communication in helping our patients cannot be overemphasized. In fact, communication is therapeutic as it has to do with listening skills. Communication, listening, which is part of communication, is therapeutic. So we cannot but continue to learn to improve ourselves in the area of communication with our patients, with the providers, communicating diagnosis during their treatment. It cannot be overemphasized. Psychological intervention, they are all under psychosocial oncology services for patients and family. And then we look at education and training in psycho-oncology. Today we are talking that we have ECHO program, and what we are doing now is education in a way for us to learn a little more, to understand what psycho-oncology is, because POSON has continued to give yearly conferences, and during their conferences, they look at research, they present papers, and they also give skill training. This is education. Research addressing psychological issues. As a psycho-oncologist, you are also a researcher. A psycho-oncologist is a researcher, is an educator, is somebody who gives community services. Because psycho-oncology is not about the clinical areas alone. Psycho-oncology is also domiciled in the community. Psycho-oncologists to the young and adolescents, the youth, the children, wherever you find them, these are there. We do research so that it can go into policy and there will be interventions. Publication of research findings and scholarly writing. We are encouraged because when we do research and we publish it, then it will reach to implementation. And that is where we improve. It will impart our clinical practice, which is very, 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 very important. Challenges that we have lack of political will. Because of lack of, psycho-oncology would have grown more than this, even in Nigeria, with all that we have been putting in. But we lack political will. Today in ECHO program, we saw how many teaching hospitals where we have psycho-oncology. How many medical centers that we have psycho-oncology. How many universities that we have psycho-oncology compared to the number of universities in Nigeria or number of universities, teaching hospitals in Nigeria. There are still few. We still have a lot to do. But without political will, we cannot do much. That is why this year we have actually admitted a lot of doctors who tomorrow will become CMDs in helping. The CMDs in helping, they will advocate for psycho-oncology. They will advocate for it. Most of these people will not go practicing giving distress assessment or giving interventions. That may not be the areas of their expertise, but we think that they are going to be useful in advocacy, in speaking for us so that psycho-oncology can be practiced, developed and practiced in all the teaching hospitals and federal medical centers in Nigeria. We have financial toxicity. There's no money. And you know the situation of things right now. There's no money. Many people are doing work they've been paying them. Patients are lacking money. The healthcare facilities are lacking money. Without money, you cannot go far. Lack of manpower. We don't even have the manpower. That's why we keep on training. That's why we are, whatever the little that you know in psycho-oncology, you can also put it into a useful, good use. Lack of knowledge in theory and practice of psycho-oncology. Many people don't know it. Because they don't know it, they speak negative things about it. So that's why we are the person and the present executive that thought it wise that we should just give this knowledge through this running of this webinar. People will get to know more about psycho-oncology and then help us to spread it. Cultural practices. There are some cultural practices that delay the practice of psycho-oncology. And they are there, and we need to jointly, through education, to clear some of them. Then training area, I put on these slides, training areas in of psycho-oncology. The Psycho-Oncology Society of Nigeria was formed in 2009, under the supervision of by Prof Asuzu and all her students. Then she didn't really, Prof Asuzu didn't work alone. I want to tell you, Prof Asuzu didn't work alone, but Prof Asuzu is somebody whom I say God gives me people, and once you have people, you have money. In fact, once you have people, you have everything. You know, I was very, very fortunate to have very good students. And we work together. Whatever that you people think have been achieved, it's also we achieved them together. And we had a good guidance. Professor Campbell was also there with us. And so when I came back from intern program, and which when I came back, I make sure that my mentees will also enjoy it, because this is who I am. And because they have enjoyed it, we can all collaboratively work together and move things forward. And that was the beginning of that. And one of the goals was to build psycho-oncology in order to enhance psychosocial care for cancer patients in Nigeria and beyond. We organized this training in the work of psycho-oncology to conduct research and to advocate for funds to assist patients. The Psycho-Oncology became a federation member in 2011. What are the administrative, what have we done putting all these things together? Founding, yes. Prof Asuzu, founding president of POSON. Yes, I put it there. I did not work alone. I did not work alone. I worked with Dr. Aki Odonye. Dr. Aki Odonye was the secretary until 2021 when she became the president. And we all worked together. And Dr. Joyce and Tewase, three of us worked together. I called them. When I came back, they were my students. And you know, students will always follow their supervisor. When I say we go here, they will follow me. So I told them, this is what I want to do. And this is what I learned from where I went. And I think this is my long-term objective. Of course, they have to follow me. And we work together to get it established. And I will say, even though we are saying 2029, that was official time, we have started working quietly. The wisdom, Professor Campbell, we should work, nurture it until it has been registered by CAC so that it will not go into extinction. And that was a wise counsel. And we cannot talk about this thing without talking about how he had helped us. And all the board members have helped us. Professor Asuzu is always there with us. Professor O'Hary and Dr. Tony Marino. And as this happens, I was elected into IPO's board in 2015 and 2019. And this, I can't say this is all that me, no, because we worked, this came after we had conference in Egypt. And they wrote Professor Kesen wrote a recommendation to IPO's board. And Barry Bush was the president of IPO's then. Barry Bush called me one day and said they want me to join the IPO's board. And they have seen how active I have been. And this position will be contested, that I should apply, and somebody else will also apply from India and from Russia. They need somebody to be a member of board for India, Russia, and Africa. And when we contested, that was why I won the election into the board. And I stayed there till 2019 as a director. But we also, I continued as executive secretary, as treasurer, and now as vice president. I will not attribute all this to me. I will attribute it to the collaborative effort of Nigerian psycho-oncologists. And I enumerated this thing here, not because I don't know it or you put for a point, to make a point that we need to start climbing the ladder. We need to start climbing the ladder and to become visible in the next elections. That's why I put it there, because you just have to climb the ladder. Then we have masters in psycho-oncology approved in September 2015. I'm saying this, talking about this, because I was in the Senate that day, and I was the only member of the department in Senate, was going almost 10 p.m. in Senate of the UI in 2015 when this approval came. Then Jimmy Holland, who wanted psycho-oncology to be in the mainstream of aortic, got me elected into ALTIC as vice president because she said she's getting old and the husband has been sick. She is not sure if they will continue to be coming to ALTIC. And that was how I got into ALTIC, and to make sure that the presence of psycho-oncology is visible in all these areas. And when we go to ALTIC, it's not just only me. When we go to ALTIC meetings, that we have academies. We are all there. Joyce and Aki Odonye, they are always there. We are always there together, planning and trying to find out how things can work out well for Nigerian contingents. Recommendation: we should continue to work hard to build psycho-oncology despite the challenges in Nigeria and Africa. We should build partnership in clinical practice, in research, and whatever it is, we have to build partnership, because building partnership is the way forward, is the way to go now. We should also ask for grants, because we lack money. Many people think psycho-oncology is free. If we have money, we can award scholarships. It's unfortunate that Jimmy Holland is not alive, because if he's alive, he will continue to support us. It's unfortunate he's not alive, and we are not getting this another person that has such a large heart. So we need to work together to see how to source for grants. Even now, they told us ECHO, the Jimmy Holland family are saying, sorry, they may not be able to foot the bill of the next ECHO program. And they asked me, how do we source for funds locally? It's not just them looking for funds. We have to source for funds from Africa, from Nigeria, as to even how to move our ECHO program forward. We need to look for how to look for money. Are there good willing Nigerians to help us in this area? That's a question. We should also join IPOS and become very active so that we can continue to collaborate, we can continue to build, we can continue to support both our local POSON and our global IPOS. You know, we can continue to work. So, okay, thank you so much for listening.
Thank you so much for that in-depth introduction to psycho-oncology. It was very, very educative and enlightening. So I don't know if we have questions. Anyone has questions or contributions, comments from the floor? Questions? So I'll just look at the chat. I saw a message dropped in the chat says there is huge need for us as patient advocates to improve our communication skills through regular trainings like this. Also, there is need to give this series of training in psycho-oncology the widest publicity. Thank you very much for that comment, Cecilia Ubang. Thank you. Do we have any other questions? Questions? Okay. Maybe I could also, well, I think most of the questions that relate to today's webinar have been answered somewhat by the presentation that Prof actually made. And I want to see, okay, we've addressed the question of the scope of psycho-oncology, and Prof also talked about the multidisciplinary nature of psycho-oncology, which also stated the roles of the different medical professionals that are involved in psycho-oncology, which is one of the questions here. What is the role of the different medical professionals in psycho-oncology? That has been dealt with. There are other questions that were actually dropped during the registration phase, of why participants were registering to participate in this webinar. And one of the questions is, at what stage of illness can psychotherapy be introduced in cancer care? I don't know if Prof can help us in answering that. At what stage of illness can psychotherapy be introduced in cancer care?
Okay, thank you very much. I will just say that psychotherapy can be introduced at every stage. But as a professional person, you have to, if somebody comes to you, you have to assess your client. Either you use distress assessments or you use Edmond's psychosocial scale. Whichever one you use, you must identify the problem. Then you will now find out the appropriate psychotherapy that you are going to use to help your patients. You assess and then you manage. But can you, yes, even if your patient is coming in, you are admitting your patient, you can even, as you are admitting your patient and you are communicating to your patients, you are reducing your manner of communication, is reducing the stress in that patient. It's making the patient feel good. At FMC Abeokuta yesterday, the woman, after we finished giving psycho education, the woman felt very good. She said, you people should be coming every day. Hey, please, you people should teach the doctors. Teach them. You know, this is what they told me. This is what they told me. So if that doctor who made her had talked to her, answered her question, then she will not be saying that. So you can give psychotherapy, but after assessment, so that you can diagnose what actually is the psychological problem that you want to give the psychotherapy on.
Thank you very much, Ma, for that answer. So in other words, we can provide psychotherapy or psychosocial services at any point in the cancer care continuum. Thank you, Ma. So Samson Chinonso also asked a question. He said, thank you, Prof, for your presentation. My question is, how can I join the organization? Can you hear me?
My daughter, no, we can't hear you.
Yeah,
this thing was freezing.
For a while.
No, we can hear you, doctor. We can hear you.
Am I back for a while? I'm back now. Yeah, I have power failure.
Okay, good.
NEPA has struck.
Oh.
Yeah. So the question is,
hello,
how
Prof.
can I join the organization?
Yeah.
Hello.
So for Samson,
hello.
Can you hear me?
Yes, we can hear you faintly.
Okay. So for Samson, to join the organization is simple. If you are requesting to join, we have your contact from the registration. We could send you the registration form and other details that are required. So I'll be in touch with you, say by next week. Thank you for your interest.
Thank you.
Any other?
Hello, Prof.
Yes, please.
Hello. Yeah, Prof. I'm Umar from Gombe, please. Hello.
Yes, we can.
Together?
Hello, we are hearing you. Yeah.
Yeah. Just a simple question, please. I want to know, how do you recruit your patients, please, or clients, let me say?
How we work in the hospitals, and also we go to communities, as I have said.
Yeah.
Even we healthy patients are our client because we do screening. We talk to them about breast cancer, and they encourage healthy people to go to well person's clinic to go and screen. We talk to them about cancer of the cervix. We ask them to go and do pap smear.
Yeah.
So we talk to healthy people. We talk to people about diet, healthy people in the community. Yeah. And that is why during my presentation, I show the continuum of cancer care and also show the different topics that are within the psycho-oncology. Those topics have a lot of subtopics. But if we are looking at topics like that that alone can take 1 hour to discuss. And so
yeah,
I
I
only gave
understand that, Prof. Yeah, I understand that. But what I'm trying to say is that, okay, patients comes to doctors, other clinicians, let me say, and they normally neglect the psychosocial aspects of the treatment. So, and your concern is to look after that, right? So how do you
yes.
now start giving the intervention? I saw evidence-based intervention. You talk about that. You know, the doctors will not look at
Yes.
that. Yeah. So when the patient come to the hospital, their concern is the medical aspect, the oncology aspect. Yours is the psychological aspect, right? So they will
Yes.
not care to assess the distress of the patient. While for them to refer the patients to you, if I'm right. So how do you now take the patients from them? That's what I want to understand. And along the line,
Okay. I understand what you are saying. Like in our hospital here, Department of Radiation Oncology, where the patient come, we have every Tuesdays that we run psycho-education. The days that they are running clinic, that the patient come.
Yeah.
So when during the psycho-education, when we give them, we arrange it that every month we talk to them about certain type of cancer.
Okay.
And so after talking to them, any one of them that are in distress that want to see any of us, we wait.
Okay.
And what the normal thing that when the patient comes, if any patient visiting for the first time, before the patient can see the doctor, when he's seeing the nurses, the patient distress should be checked.
Yeah, good.
When the patient is seeing the doctors, that's what they are recommending, distress assessment as the sixth vital sign. You know, we have temperature, pulse, respiration, blood pressure, pain assessment, the fifth, and distress assessment, the sixth. So this is what we are working towards. This is what we are working towards. What we are doing now, that most of the patients that we are using for research, like now in one of the centers that I work, every new patient on their clinic days, we assess for this. We do that before they go and see their patients, because they go and see the oncologist. And also, the oncologists now, some of them now understand when the patients are in distress, they refer to us. Some of the oncologists refer their patients to me. Tell me, even though it's not in that department, they call me like gynecological oncology. When their patients are in distress, they call us. So if they know that you are doing that, that's why we need to create awareness. And that is why we can't work alone, because when a patient comes to the hospital, he's coming to see a doctor. He's not coming to see a psycho-oncologist. The patient is coming to see a medical personnel. And the patient is registered under a medical. And we know that the unit, that this aspect of the care can be done even before they go to see their doctors. And then you continue, you can now give them follow-up. I want to see you and not this day. I would like to see you and not this is the therapy. Then you tell that you want to do. We cannot do work alone. We have to work with the oncologist.
Do you accommodate the formal caregivers, the nurses, the doctors, in your interventions? You know, they are also facing distress, vicarious trauma, let me say. So how do you accommodate them in your intervention?
Oh, we depend on intervention. If it's the patients, we caregivers. We did a small intervention the other time on the doctors and not It is on what you want to do.
No, what I'm asking is that, okay, if you notice a kind of distress in a doctor or a nurse, how do you now provide a kind of intervention support to this
if they are having
vicarious trauma? I'm talking about vicarious trauma. They are dealing with this patient. Mostly the patient come late to the hospital with late diagnosis, you know, so this will lead to vicarious trauma. So the person there, safe and efficient intervention to these patients. You need to look after them as well, not only the informal caregivers and the patient alone. Am I communicating, Prof?
Yes.
You say, how do we accommodate them? I didn't seem to.
How
do we accommodate them?
In services.
The professionals, doctors, yes, in your intervention, the psychosocial intervention, they are also facing with this vicarious trauma.
Yes, they are facing with burnout. They are having burnout.
Doctors undergo burnout.
Yeah.
They have burnout. Okay. If they have burnout, that one, and we know that they have stress. They can also be helped.
Yes.
To solve the problem. Yes, but so far, they have burnout. We all have this stress when we see some of these patients. It depends on your personality and coping mechanism. Some, the burden of it may be more than the other ones.
And then professionals also have the ability to self-refer. They know the psychologists, they know the psycho-oncologists. If they know that they're experiencing burnouts, they can self-refer. Of course, they will be seen if they self-refer.
Thanks so much.
Thank you, Dr. Omar.
Okay.
Hello?
We can hear you.
Hello?
We can hear you.
My name is Mustafa Aliu. I am an oncology nurse from Federal Teaching Hospital, Gombe. I want to thank the presenters for that elaborate presentation. I want to also say a big kudos to our mother of psycho-oncology, if I'm allowed to say, Professor Asuzu. I'm one of the attendees of the workshop that was held in Ibadan some years back, and it was really an exciting moment. My question is, the issue is that you need to have a kind of psycho-oncology unit for example, in a in a radiotherapy unit or oncology unit. So what are the need assessment for one to set up that particular unit, and who are the members of this team? Thank you so much.
Okay, Mr. Mustafa, I think I can remember you attended when we had it in
That's fun.
Exactly.
Since then, we have not been able to see you again. We are happy to connect with you. Thank you.
Thank you so much.
We are happy to connect with you. Yes.
Thank you so much.
Okay, so you need psycho-oncology needs, radiation oncology or oncology center, wherever. But what I see that radiation oncologist departments have been really very favorable globally. Most of the psycho-oncology units, with my experience, is domiciled in radiation oncology. They are very receptive. The ones when I went globally, radiation oncologists are very receptive people. And so we have ours here in radiation oncology. We have it. You can build there. And when you came, we always have this talk on building and developing psycho-oncology units or centers. You know, you look for a doctor, an oncologist that can work with you people. You can make the person the head. It doesn't matter. Because you need the patient from that person to be seen, to be able to do something. Do you understand what I'm saying? In our own case, Professor Campbell was there for us. He was there for us. Okay? So look for a doctor or some doctors. We are lucky here in UCL. We have some doctors who are very supportive. very senior doctors, senior oncologists, get them close. Let them tell them that you want to do this very thing. The nurses are also very important. Social workers are also very important. The dietitians are very, when you can call a meeting now and say, this is what people want to start. You as a nurse can be the instrument through which you can build this very thing. Okay? People can start by doing needs assessment. Fine, you can do research. When you can, in our department, we run this thing. Take one day, the day of your clinic, that you people can give psycho-education. Talk to the person about cancer, different kinds. Let them ask their questions. Give them counsel. Other people who are more distressed, then you give them special intervention. That is how you people have to start. Small. And then if you need our help, please contact us. We'll be willing to help you. POSON will be willing to help you.
Thank you so much.
They don't mind. They can come to you to run 1, 2 or 2 day course. You people to start off very well. POSON can do that.
Okay. That would be very helpful.
Yes.
So
thank you so much.
Thank you so very much, Professor Asuzu, for taking your time out of your busy schedule to help us in facilitating this webinar. And I want to thank everyone that has participated in this webinar for participating actively, for the questions. And I'll ask Dr. Sarimiye to give the final word and to maybe about future webinars and to close this meeting. Dr. Sarimiye, please.
Okay.
Please answer the question of Chinton so before Dr. Akeodoye.
Okay, the question on
Dr. Sarimiye can now answer it and then close the session.
Yes, the person also asked 2 questions. He asked about membership, for which I'll contact him next week. I'll send him forms and other requirements. He also asked for short-term courses for those that may not be able to afford the master's program. I think that's where this program is like filling the gap so that everyone that's unable to afford the master's program in UI on psycho-oncology could also learn. So, I mean, the important thing for us is we don't want the patients to be left hanging. And so, at all, not bad. We need skills. Let's start from wherever we are, learning what we can, learning on roots. And so that's one of the essence of this webinar, so that those that are unable to, for whatever reason, are unable to do the full master's program would access this. But there are no short-term courses. You could attend our conferences. We have workshops, we have trainings, you know, in those conferences. And the one for this year will be coming up September 5th to 6th in Enugu. So let's just, you know, keep our ears on the ground for these conferences. Abstract is still ongoing. Submission of abstract is still ongoing and will be closing sometime in August, if I'm not mistaken. So, but let's just, okay, it's ongoing till 5th of August. So let's, as much as possible, we'll also, you know, give you information about whatever other webinars internationally or locally that are freely available for you to be able to attend. Hope I've addressed your question. Dr. Sarimiye, please.
Yes, thank you very much.
You're welcome.
Yes, so thank you so much for that enlightening, educative session. Professor Chioma Asuzu is always very interesting and nostalgic for me when you go down the memory lane. And your passion is very palpable, always palpable, true, whenever you talk. So thank you so much, Ma, for enlightening us again, once again this evening, and for broadening our perspective and giving us, quickening our desire and our passion once again in psycho-oncology. So this educational work, said in the beginning, it's work has been in preparation for a while, and our desire is that we would have it quarterly, in a year, but as it goes on, we'll see if we need to modify or make it monthly if we can. Concerning your question on about masters, short course, and all those things are things that Professor Chioma Asuzu, Dr. Akindoye, and the team will be looking at. So if we can, we'll put it together, because we understand that people have different aspects in life and might not be able to even come back. Even we were also talking about having the masters online. The time we talked about that, and then maybe people just come down for their practical. So we'll keep the public informed about if there's any form of modification concerning this. But as Dr. Akindoye has said, this is what we have for now, the webinar series, which will be educative and will give information, and then we'll see if we could develop it more so we could have maybe like certification at the end of a short course. So thank you so much for coming. You'll get the recording of this session sent to your mail in a bit, and then we hope to communicate when we have another webinar series, which we hopefully should be in 3 months, but we'll communicate and we'll send out the information and flyers and everything. So thank you so much for taking out time. Bless you and wish you a wonderful week.
Yeah, thank you.